Hi, I'm Dr. Carreen Pakrasi, Director of Ophthalmology Services at Medanta Hospital, Gurugram and Delhi. Today, I'm going to talk about farsightedness. Farsightedness is diagnosed in several ways. The first point is when the patient comes to us. Which are the patients who come to us? Parents will complain the child has headaches or squint. If any of these two things are there, when we see the patient at the OPD, we first check their vision. To check the vision, we do something which is called an autorefractometer, which determines the length of the eye and the way it impacts the vision. Now, after we have done the autorefractometer, we take the patient to do the acceptance. Acceptance is that refraction which the patient needs to focus perfectly on the retina. Once we do the initial acceptance, we have to dilate the pupils of the patient with dilator depending on which kind of refraction the patient has. If the child is very small and this is the first diagnosis, or if the child has a squint, then we have to use long-acting and very strong dilators for the pupils, because the patient has been using their muscles to make their vision okay for so long that the muscles may be in a spasm. We call this a ciliary spasm. And to break that ciliary spasm, we have to use a very strong dilating drop. Sometimes we give the patient an ointment called atropine for 3 days and then call them back to do the refraction. After we have done the refraction, we see what is the number that the patient is showing on the refraction. This number is a net response of the length of the eye and the curvature of the cornea. When we find that, we call the patient back for a post-refraction test. This is called a PMT, that is post-mydriatic test, to determine the number. Then we prescribe the glasses and ask the patient to wear them. Farsightedness is treated with glasses only. So what is the important thing about the glasses? One, you have to get the proper number after dilation. Two, you have to adjust the dilated refraction to the number that you're actually going to prescribe the patient. Once we prescribe the number, you make sure that the patient is following up regularly. Sometimes these patients can have something called lazy eye. Lazy eye is amblyopia. Amblyopia happens when the child is detected later in life and they have not been able to use that eye for a long time because they haven't had the proper refractive error correction. So once that happens, you may sometimes have to treat the amblyopia by doing a patching in one eye or both eyes, depending on what is the condition. Then you follow them up frequently, see if they're developing a squint, because this can also be caused by the farsightedness, and you treat the squint if required. So farsightedness is a problem which occurs in children. You are born with a smaller eye, and very importantly, the sooner you treat it, the better is the prognosis for the patient's vision. Because when we talk about vision, it is not just how much you can see or how much you can read. It's also about binocularity, which is the depth of vision. So the earlier you detect it, the better it is for the patient. So people will often ask us, what is the earliest age that we need to get our child's vision checked. So normally we will say that children of school going age must have one check. That is because once they learn the alphabets, then it is easier for the doctor to determine what is the vision. However, children may also have hyperopia or farsightedness earlier than that. They can be born with it. If their eyes are smaller, they will show hyperopia, which results in an inability to see at near, which because of the fact that they are stressing their muscles to see, they will develop a squint. So sometimes people come to us with a squint. So that squint is because of the fact that the child has farsightedness, and the moment you treat the farsightedness, that squint can go away. So this is different from the farsightedness that you have in elderly people. So elderly people may develop farsightedness after 40. That happens due to different reasons. So people who are older, till the time they are 40, their muscles are able to cover up any minor farsightedness that they have. So they are always straining their eyes to see in the distance, but this happens without any effort, so they cover it up. This is called latent hypermetropia. So latent hypermetropia is something that is not seen. So when the patient comes to you, only then when you dilate the pupils will you be able to see it. You may not even know that the patient has hypermetropia. So till the age of 40, your muscles are strong enough to cover up this difference. But after 40, the muscles which are required to focus, which are the ciliary muscles, loses their power to function at near. So that time you may develop hyperopia or farsightedness, which is due to age.